Di pelajaran kali ini, pertemuan ketiga itu membahas tentang postpartum. Jadi lebih kepada nifas, kemudian juga ada beberapa speaking practice di belakang. Jadi kita akan coba sama-sama untuk mempelajari apa aja sih kira-kira kalimat-kalimat yang biasa digunakan di fase postpartum. Sebelum lanjut ke inti, yaitu masa nifas, kita belajar dulu untuk flashback lagi mengenai tenses. Dalam bahasa Inggris dikenal istilah tenses ya, atau bentuk kata kerja seiring waktu kejadian. Waktu kejadian menentukan bentuk verb atau kata kerja yang akan digunakan dalam suatu kalimat. Ada 3 kategori utama waktu kejadian, yaitu lampau, sekarang, dan mendatang, yang dalam bahasa Inggris disebut past, present, dan future. Untuk memperjelasnya, perhatikan contoh-contoh dalam tabel berikut. Past tense, I bought a book. Present tense, I buy a book. Future tense, I will buy a book. Ketiga contoh di atas menunjukkan 3 aktivitas yang dilakukan pada waktu lampau, sekarang, dan mendatang. Terlihat bahwa bentuk kata kerja buy mengalami perubahan atau penambahan pada masing-masing waktu kejadian. Kita dapat melengkapi 3 aktivitas itu dengan adverb of time atau keterangan waktu kejadian seperti pada contoh berikut. Past tense, I bought a book yesterday. Present tense, I buy a book every day. Future tense, I will buy a book tomorrow. Oke, lanjut ke postpartum care. Di sini postpartum care after birth with midwives continues for 6 weeks. During this time, there are schedules appointments with your midwife at your home and or in hospital, and at the clinics you can also patch anytime with urgent concerns or questions. Jadi di sini menunjukkan bahwa apa aja sih kira-kira asuhan ataupun tindakan ataupun konsul yang dilakukan ketika postpartum care. Jadi kita bisa bilang kepada misalnya klien kita, kalau habis nifas tuh apa aja sih yang dilakukan bidan kepada kita, seperti itu. Biasanya muncul pertanyaan, what does a midwife do after birth? Kemudian kita bisa menerangkan kepada klien kita bahwa after your baby is born, your midwife will care for both of you and your baby immediately after birth. The midwife or your doctor will check whether you have lost too much blood or need stitches. Midwives offer postnatal care in the hospital, including helping you with breastfeeding and settling your baby. Jadi ketika ada klien menanyakan apa aja sih yang dilakukan bidan setelah lahiran, nah kita bisa jawab nih kepada klien kita, kayak gini loh yang dilakukan setelah bayi lahir. Kemudian kita juga bisa menambahkan, during postpartum visits, your midwives will assess the health and progress of you and your baby, assist with any breastfeeding difficulties, and make a referral to a lactation consultant if needed, weigh the baby, offer routine newborn tests, terutama untuk jaundice screening, Ontario newborn screen, hearing screen. Jadi ini tes semua ya. Kalau di kita lebih kepada refleksnya, seperti itu ya, refleks moro, refleks sakingnya, mungkin itu akan berpengaruh juga kepada IMD-nya, seperti itu. Dan juga ini mungkin lebih kepada ini, lebih kepada ke refleks terutama ketika IMD pertama kali. Kemudian provide advice on normal newborn care and development. Discuss the physical change you can expect after the birth. Jadi ketika kita menyampaikan apa aja sih yang dilakukan bidan, kita bisa sebutkan ini semuanya. Seperti itu. Kemudian kadang ibu bertanya kepada kita, how long does it take to recover after giving birth? Kemudian kita bisa menjawabnya, kita bisa mengkonseling beliau, ibu tersebut. No matter how you gave birth, the first 6 weeks postpartum are considered a recovery period. Even if you sailed through your pregnancy and had the easiest delivery on record, especially if you didn't, your body has been stretched and stressed to the max, and it needs a chance to regroup. Keep in mind that every new mom is different, so everyone will recover at a different rate with different postpartum symptoms. The majority of this is up within a week, while others, sore nipples, packages, and sometimes perineal pain may continue for weeks, and still others, like leaky breasts or itchy back, might stick around until your baby is a little older. Jadi ketika kita bilang untuk kapan ya kira-kira setelah kita lahiran tuh kita tuh bisa recovery gitu kan, itu semuanya tergantung kepada masing-masing individu karena banyak sekali faktor yang mempengaruhinya. Kemudian ini yang paling penting yaitu vaginal bleeding after birth. After you give birth, postpartum bleedings di situ bukan oosia tapi lokia, can last for up to 6 weeks. It will be just like a new heavy period made up of leftover blood, tissue from your uterus, and mucus. Bleeding is heaviest for the first 3 to 10 days, then it will taper off, going from red to pink to brown to yellowish white. If you spot large clots or you're bleeding through more than one pad every hour, call your doctor right away to rule out postpartum hemorrhage. During this time, tampons are off limits, so you'll have to rely on pads. Jadi di sini ketika yang terpenting itu memang perdarahan ketika setelah persalinan yang terjadi adalah harus diperhatikan tanda-tanda apa aja sih yang perlu diwaspadai seperti itu. Jadi itu juga kita berikan kepada pasien ketika kita mengkonseling selesai lahiran. Karena biasanya ngaruh ke atau neoperi seperti itu. Kemudian ini lanjut ke what do you need to know about postpartum depression. Jadi lebih kepada kalau di depresi postpartum itu memang kita rujuk ya, tapi sebelumnya kan mungkin ada postpartum blues seperti itu. Jadi tetap mengarahnya ke situ. Kita bisa bilang kepada ibu, there's no doubt that having a baby is a life-challenging experience. Almost every mom faces the baby blues due to a roller coaster of hormones, lack of sleep, and the struggle to adjust to that tiny new human at home. That said, if you have symptoms of postpartum depression, including feeling persistently hopeless, sad, isolated, irritable, worthless, or anxious for more than 2 weeks postpartum, talk to your doctor. Don't feel ashamed or alone. Postpartum depression is not your fault, and it affects up to an estimated 1 in 4 new moms. The only way to feel better so you can care for yourself and your baby is to talk to a professional who can help. Jadi yang pertama untuk baby blues itu adalah sering terjadi dan itu juga merupakan suatu hal yang jika tidak ditangani maka akan berlanjut ke postpartum, depresi postpartum. Jadi kita lebih fokus kepada the baby bluesnya, postpartum bluesnya ditangani dulu. Setelah itu kalau misalnya nggak bisa ditangani, baru kita lakukan rujukan bahwa ini diagnosanya adalah depresi postpartum. Oke, untuk speaking practice di sini ada 5 atau 6 artikel, kemudian sudah kita bagi dan untuk penilaiannya sama, penilaian untuk speaking practice yaitu dibagi sesuai dengan kelompoknya. Oke, kita coba. Yang pertama adalah postpartum period, ABSEN 1-5. Di sini postpartum period Disorder experienced by mothers was characterized by severe fatigue, poor concentration, tiredness, sadness, and anger at her husband. These postpartum mood disorders could progress to postpartum depressions and postpartum psychosis. Childbirth care counseling was an attempt to allow mothers to adapt to her postpartum condition. The objective of this research was to identify the effect of childbirth care counseling on postpartum mood change at Leeds General Hospital, Kulon Progo. Jadi ini penelitiannya di Kulon Progo, dekat-dekat sama kita. This research used experimental design with post-tests. We used purposive sampling to obtain 20 respondents in the experimental group and 20 respondents in the control group. Moreover, EPDS instruments were also used in this research. Several normality tests resulted in SD less than 0.05. The main weight net test resulted the T table is bigger than set 2.054, and for alpha 0.040 is less than 0.05. We found that there was a significant benefit of childbirth care counseling on postpartum mood change at West General Hospital, Kulon Progo. The significance of this research is that health workers in prenatal units should provide counseling about postpartum care to mothers in their third trimester. Jadi di sini untuk penyebutan Kulon Progo jangan di bahasa Inggris, kan tetap Kulon Progo seperti pengucapan lokal. Selanjutnya, self exclusions from healthcare in women at high risk for postpartum depression untuk absen 6-10. For the background, a significant proportion of women who are vulnerable to postnatal depression refuse to engage in treatment programs. Little is known about them, other than some general demographic characteristics. In particular, their access to health care and their own and their infants' health outcomes are uncharted. Methods: we conducted a massive cohort case control study using data from computerized health systems and general practitioner (GP), kita biasanya menyebutnya GP, and maternity records to identify the characteristic health service context and maternal and infant health outcomes for preemperors and antenatal clinic attenders at high risk for postnatal depression who either refuse, yang dia masuknya ke self-exclusion group, or else agreed, take-up group, to receive additional health visiting support in pregnancy and the first 2 months postpartum. Results: women excluded themselves from health visitor support were younger and less highly educated than women willing to take up this support. They were less likely to attend midwifery, GP, and routine health visitor appointments, but were more likely to book in late and to attend accident and emergency department, or ANE. Their infants had poorer outcome in terms of gestation, birth weight, and breastfeeding. Differences between the groups still obtained when age and education were taken into account for midwife context. ANE attendance and gestation, the difference in the initiation of breastfeeding was attenuated but not wholly explained by age and education. Conclusion A: as subgroups of physiologically vulnerable childbearing women are at particular risk for poor access to health care and adverse infant outcomes. Barriers to take up services need to be understood in order better to deliver care. Jadi di sini lebih kepada ada suatu kelompok studi di komunitas bahwa yang memiliki resiko tinggi untuk depresi postpartum. Jadi ada pengelompokannya sehingga nanti sebisa mungkin tidak terjadi postpartum depresi. Lanjut ke hemorrhagic postpartum. Jadi di sini sampai ke perdarahan, kita membahas perdarahan. Untuk Introduction: maternal death occurs as a result of complications during and after pregnancy and childbirth. As many as 80% of maternal deaths in the world are caused by heavy bleeding, especially bleeding after childbirth. Infections, high blood pressure during pregnancy. According to data from the Ministry of Health in 2010, bleeding was the highest percentage of maternal mortality in Indonesia, which was 28%. Case reports a woman 30 years old came with a decrease in consciousness and heavy bleeding from the genitals 3 hours before hospitalizations. Pulse felt quickly and smooth. Patients previously delivered at home were helped by a midwife 10 days ago. All their siblings born 30 minutes after the child was born, and the impression that the midwife was fully recognized. Final diagnosis is the patient's hemorrhagic shock overcoming for the late HPP because of the placental residue plus moderate anemia. The hemoglobin is 7.0, and the conclusion in this case proved that HPP is still a frightening thing as a cause of maternal death. In this case, it feels necessary to have a referral pathway for emergency cases, namely the grouping of cases in labor with complication of immediately reporting cases to DINCAS for referral to the hospital. After treatment at the hospital is complete, continued treatment or postnatal care is carried out on schedule. The patient is resulted after completion of treatment, and the reverse results are reported back to the district or city health office hotline. Jadi lebih kepada ada HPP, ada riwayat ya untuk HPP, ditambah juga ada anemia juga, HB-nya 7,0. Jadi ini menyebabkan perdarahan juga di postpartum, dan itu juga harus diwaspadai. Oke, kita lanjut ke absen 15-18. Midwives attitudes to counseling women about their smoking behavior during pregnancy and postpartum. The objective is to investigate the attitudes of midwives to counseling women about their smoking behavior during pregnancy and postpartum. For the design, the research used survey using postnatal questionnaires. The setting is in the entire federal state of Mecklenburg-West Pomerania in Germany, and the participants is 189 midwives, constituting 77% of all midwives working in that state. The findings is midwives report that they assess smoking behavior regularly. 77% address the consequences of smoking. 70% and advise women to quit. Among the midwives, 81% saw low chance of success and parents' expectations as the biggest barriers to counseling. Midwives reported that about 28% of women quit following their advice. The key conclusions: smoking and exposure to environmental tobacco smoke are seen as prominent health threats that midwives reported they address routinely, including giving advice to stop smoking. The implications for practice: midwives should be supported in learning effective intervention strategies to further strengthen their work. They are a target population to deliver brief smoking interventions. Jadi untuk ini jarang juga ya ke kita untuk memberikan advice maupun konseling kepada ibu nifas, karena mungkin untuk perilaku merokok ini jarang sekali terjadi, meskipun juga ada, tapi di sini karena lokasinya di Jerman sehingga itu sangat mungkin, karena di situ terlihat ya bahwa 81% itu melihat banyak sekali barrier ketika dia melakukan konseling, dan hanya sekitar 28% yang bisa berhenti untuk merokok. Oke, lanjut. Untuk absen 19-23, a systematic review of midwife-led interventions to address postpartum post-traumatic stress. Jadi di sini untuk objektifnya to systematically identify interventions that midwives could introduce to address post-traumatic stress in women following childbirth. The methods a search strategy was developed and relevant papers were identified from database include Channel, Cochrane Library, MBS, Maternity and Infant Care, Medline, PsycInfo, and Web of Science. Key search terms used were post-traumatic stress, postpartum intervention, control, trial, and review. Papers eligible for inclusion for primary studies and reviews of research published from 2002 until 2012, focusing on interventions which could be implemented by midwives for the prevention and/or management of PTSD. For primary studies, RCTs, controlled clinical trials, and cohort studies with a control group were eligible. Eligible reviews were those with a specific search strategy and inclusion or exclusion criteria. Methodological quality was assessed using recognized frameworks. And the findings, 6 primary studies and 8 reviews were eligible for inclusions. The majority of included studies or reviews focused on the breathing and/or counselling intervention. However, the results were not consistent due to significant variation in methodological quality and use of these similar interventions. 2 of the reviews considered the general management of postpartum PTSD and 1 broadly covered anxiety during pregnancy and the postpartum compression, incorporating a section of PTSD. The majority of women reported that the opportunity to discuss their childbirth experience was subjectively beneficial. The conclusions and implications for parties. No evidence-based midwifery intervention were identified from this systematic review that can be recommended for introduction into practice to address PTSD. It is recommended that future research in this area should incorporate standardized interventions with similar outcome measures to facilitate synthesis of result. Further research on interventions used in non-maternity populations is needed in order to confirm their usefulness in addressing postpartum PTSD. Jadi di sini memang untuk kewenangan bidan memang masih abu-abu antara kewenangan bidan dan psikolog, tapi kebanyakan untuk PTSD biasanya di ranahnya psikolog. Seperti itu di Indonesia pada ranah psikolog. Oke, kemudian ini untuk absen 24-27, Midwives in the UK, an exploratory study of providing newborn feeding support for postpartum mothers in the hospital. Our objectives was to explore English midwives' views and experiences of supporting mothers with feeding their newborn baby. Grounded theory methodology was used. Data were collected using in-depth interviews from 30 midwives in the north of England. Data were analyzed using constant comparison techniques. Midwives were theoretically sampled for interview from a pool of volunteers recruited from a poster promoting the study in the clinical areas. Overall, hospital midwives felt that they didn't have enough time to support mothers with feeding their neonate. To cope with these time constraints, midwives developed practices of rationing the time that they spent with mothers and the rationing of resources available to mothers to help them process mothers through the hospital services. These practices have important implications for the success of breastfeeding in hospitals, as the practices by providers who are assigned to help breastfeeding initiations described here may inhibit the breastfeeding proses. Jadi lebih kepada nggak ada waktu ya untuk bidan di UK. Di sini untuk settingnya di UK, bidan di sana tidak ada waktu untuk bisa mensupport the newborn feeding support seperti itu. Karena tidak ada waktu seperti itu ya. Jadi tadi sudah untuk pembagian tugasnya segera dikerjakan dan linknya segera dijabrikan ke saya. kita untuk batas waktunya sampai 1 minggu.